It's a conversation that has moved to the back burner for many, but one that simply won't go away. And as case numbers and hospitalizations tick up in the Northern Hemisphere, a cautionary tale from the World Health Organization.
We continue to see concerning trends for COVID-19 ahead of the winter season in the Northern Hemisphere. Deaths are increasing in some parts of the Middle East and Asia. ICU admissions are increasing in Europe, and hospitalizations are increasing in several regions. One of WHO's biggest concerns is the low level of at-risk people who have received a dose of COVID-19 vaccine recently. Our message is not to wait to get an additional dose if it's recommended for you.
Dr. Tedros warned that the uptick in hospitalizations and deaths showed that COVID-19 was here to stay, and that the world will continue to need tools to fight it, particularly as the virus continues to adapt.
Globally, there is not one variant that's dominant. The variant of interest, EG.5, is on the rise, while the XBB subvariants are declining. The BA.2.86 variant has been detected in small numbers in 11 countries. WHO is monitoring this variant closely to assess its transmissibility and potential impact.
This as the posture again shifts in the United States, that was once the epicenter of the global pandemic.
Over the past few weeks, we've definitely seen an uptick in the numbers of COVID. A lot of those patients that have been coming in for unrelated illnesses are found to have COVID. We've gone from an average of anywhere from 2 to 4% of our population testing positive for COVID to recently this past week going up to about 12%.
Even First Lady Jill Biden tested positive this week, while President Joe Biden continues to test negative ahead of his departure for the G20 in India later Thursday.
The main reason is because of behavior. We're much more open now in terms of people doing things, returning to normal activities. And I think it's also compounded a little bit by the heat waves that we've had that have brought many more people indoors to really protect themselves from the extreme weather, extreme heat that we've had. And that has, I think, also facilitated some transmission of COVID over the summer months.
As the White House encourages people to do their part in mitigating any dramatic spikes around the country.
As we head into the fall, we have more tools and systems available today to help communities this fall and winter season, including safe, updated vaccines that will be available mid-September, widely available at-home COVID test, widely available effective treatments, which can reduce the risk of severe illness, hospitalizations, and death. We will be encouraging, as I have said before, Americans to get their updated COVID-19 vaccine in addition to their annual flu shot and also RSV vaccines, as you all know.
With updated vaccine booster shots expected to be available as soon as mid-September. The Food and Drug Administration has signaled that it would likely approve the latest updated shots from Pfizer and Moderna, which both companies say generates a strong antibody response against the latest Omicron subvariant BA.2.86, while the CDC will provide guidance on who would be eligible for such an updated vaccine. Chauvin Briceby's SABC News, New York.